Joining me now, Ben Atkins from the Oral Health Foundation. We're also joined by Claire Simmons, who's been affected by the ever-worsening appointments crisis. I think we'll speak to you first, Claire, because you are absolutely there. When we talk about a dental crisis, unfortunately, you're living it. Can you tell me what's been going on with you and your teeth, you poor thing?
Well, I've never had any problems with my teeth before.
Mm.
Nothing done to my adult teeth. I was registered with a dentist, went every 6 months. But during COVID, the practice decided to become private, and I've not been able to see a dentist since. 6 months ago, my teeth started disintegrating from the inside. That's me a year ago.
Yeah.
And now I've lost most of my front teeth, and it's stopping me
Oh,
going out. Yeah,
oh my gosh,
it's
you poor thing. What happened?
not
Why
a
did they
pretty
start
sight.
disintegrating from the inside? What happened?
My GP thinks it could be the medication I've been on because I've got a lot of health conditions, so I have a lot of meds to take.
Oh,
But because I've not seen a dentist, I've got no idea. I just
gosh.
wake up with bits of teeth on my tongue.
Oh, you poor thing. So tell me
Yeah, it's
about
not
how
nice.
how hard you've tried to find a dentist, because I would imagine you've done everything you possibly can
Yeah,
in
I
that
mean, I'm
condition.
thankful I'm not in any pain,
Mm.
but yeah, I have been looking for a dentist. I've been trying all the ones locally, and the nearest I could find, I'm in South Norfolk, and the nearest I could find was the other side of Cambridge, and they wanted me there for 9 o'clock
Yeah.
and to sit and wait all day and see if they could fit me in. To get there for 9, I'd have to be on the bus from here because I don't drive before 7 in the morning.
And did you try it, or that was too much for you?
No, I just can't physically do that journey and sit there all day and maybe not see.
And if you say to, the practice you used to go to, which is now fully private, listen, help me. I've been your patient for
No,
years, and look at my mouth, help me. What would they do?
I went in last week
Mm.
and they just said we have no NHS dentists.
And if you went to the A&E at your local hospital and said, look at my teeth, they're falling out, they're crumbling on my
No,
tongue, nothing.
no, no. They've
Okay, so
just
what are
said
you going
you've
to
got
do,
to
Claire?
try and
Because
find it.
you
Who
can't carry
knows?
on
I've
like
just got
that,
to
can you?
wait. I've got no choice.
But
I've
wait for
got nowhere
what?
I can go.
Oh my God.
Nowhere I can go. I've just got to put up with it, and it's stopping me going out.
Oh,
It's really affecting my mental health, and I try and I. This is a real big thing for me. Showing people my mouth. I've not shown anyone apart from family.
well, I really
So
appreciate it. And it's really, it's a big deal to show that. I
yeah,
completely agree with you.
yeah,
And you've done a big thing to show it, because it just brings into this stark relief the actual misery and torment that people are going
yeah.
through. So just let me ask you something. When it comes to actually eating, can you? What happens about eating food?
Well, I've had to get one of the like a dental pick to be able to get any food that gets stuck out.
Oh,
So I'm
yuck.
having to do that, and then that brings some of the tooth away as well.
Oh.
Um, it's just something I've had to get used to. I mean, the photo before was a year ago,
Mm.
and this all started about 6 months ago.
I'm just trying to think of a way of something that you can do. So why don't we talk to Ben Atkins about this? I mean, Ben, this is absolutely appalling, isn't it, that Claire is having to carry on like this and cannot find anyone anywhere to help her.
I think it's awful what's happened to Claire. I think we're in such a situation now. There are so many dental deserts throughout the country giving they're focusing this money from the government on 240 dentists throughout the country.
Yes.
Well, there's 8,500 of us. It's not financially. It's about the money. It's about the time for the patients. It's about the prevention. Dental disease is fully preventable. And for a government not to understand that or be interested in that, it is wrong. We've been talking that if you brush your teeth twice a day for the fluoride toothpaste and remove the sugar, and poor Claire, I'm assuming you were saying you were taking a lot of medication. It will be in that. We should be able to prevent that happening in a modern society within the NHS. And it breaks your heart. When I've been an NHS dentist for nearly 30 years, and to work in a system that you fully believe in with the NHS, and successive governments have totally ignored dentistry, and you have to look at this amount of money that's been put into dentistry. Don't get me wrong, it's amazing we're getting NHS money put into dentistry, but it has to, because it shows the government is actually listening. But how far that will go and how quick that will go when you've got a patient like Claire, how quickly disease can affect our teeth, and smiling and going out and the mental, it shows you how important our teeth are, and this, to be able to smile and eat is critical.
It certainly
and the
does.
NHS.
Ben, talk to me about how, in your opinion, the government has got it so badly wrong for so long. Explain to people who aren't dentists and don't know the sums here, or indeed the amount of time that each patient takes up of your day, why it is that so many dental practices, like the one that Claire used to attend, decided it just wasn't worth their while to carry on seeing NHS patients and they would go fully private. Can you explain why? What are the differences in the kind of money you can earn, the kind of time patients take up, that sort of thing?
It's, as I used to, I had many NHS practices in the northwest of England, and the key thing was actually attracting dentists to come and work at the practice. It's not well as good as just me, because I can only treat maybe 2,000 or 3,000 patients in a year. But if you've got multiple practices, you've suddenly got, we've lost so many dentists, we've lost so many dental therapists, we're not qualifying enough dental nurses. It's the whole team approach in dentistry that needs to change. We used to use our dental nurses to do all the oral hygiene, so it took it off me. If you're having, we had the NHS dentistry needs to be totally focused on the preventative journey. We have enough money if we totally focus on the preventative journey, if we change the way that we're paid. So it's not maybe the actual amount of money, it's just what we've got to do to it and to focus on the correct patients, because the oral health of the country has dramatically improved over the last 20 or 30 years, but we've now got pockets where we have no dentists. And so we need to look at the workforce to be able to give Claire a qualified dental therapist who can do fillings a lot more efficiently. To be perfectly honest, they're a lot better than me, but I can do the complex stuff that really helps Claire, you know? So it's creating the time management to work with our patients, to empower them and educate them for oral health. But the NHS simply, at the moment, in its current situation, doesn't fund that journey. And we're almost penalised for doing the preventative because we don't catch what the units, the things we've got to do. And it's really important to work with our patients. And that's often why the dentist says, do you know what, I can't do this anymore. I want to focus on a preventative practice, or I want to do it my way. The NHS is...
Tell me what you make of the offer on the table. So the offer on the table is £20,000 as a one-off payment to a dentist who will go and set up a practice just down the road from Claire, so that she doesn't any longer live in an NHS dental desert. £20,000 as an incentive, and then £50 per time per patient, in addition to whatever you're normally paid if you're an NHS dentist, for each patient that you see who hasn't seen an NHS dentist for 2 years. So you've got your 20 grand and you've got your £50 per patient. Is that going to take a dentist out of wherever they're living at the moment and suggest that they come and set up in Claire's area, move their house, move their life and go and do that? Will £20 plus a few 50s, will that facilitate that?
It's a great start. It's a good start because it shows what the government's actually thinking, oh, dentistry is the problem there. But £20,000, you've got to be over 3 years. So that cuts it down into a third each time. But if it costs £500,000 just to set a practice up, would you take that risk? Would you change from a different location where you're setting, you're embedded, your children are at school, you've got your life, you've got a set of patients who you're already working for? Who's going to look after those patients? And that's what I struggle with. It's all well and good saying we're going to attract dentists in a certain area. Well, they've got to come from somewhere. So are we now going to take dentists from Manchester and move them over to Norfolk? Well, who's going to treat the patients in Manchester? So we've got to think outside the box and actually work with our commissioning bodies to say, actually, we could do this differently by maybe having 10 dental nurses do all the oral hygiene for a patient before they see somebody, because dental disease is healable. You know, we can stop disease, we can stop the decay, but poor Claire hasn't had that information to stop her teeth falling apart. It's awful.
Give me a rough ballpark figure. I'm not asking for an exact figure. Let's imagine you're doing a basic filling in you know, one of the teeth at the back, let's say, and you're doing it for the NHS, or you're doing it privately. How much, roughly, very roughly, would a private dentist get for filling the tooth, and how much do you get if you're getting an NHS payment for filling the tooth? Roughly.
It's very difficult to say individual teeth because they're all so different.
Okay, roughly, just an equivalent filling from the NHS and private, just so people can tell the difference, just so people know what dentists getting in the private sector and what they would get in the NHS sector, that's all.
It's also changed throughout the country. So in Manchester, it might be, say, £100 for a filling on the back tooth, or £200, depending on the, because it can go from £100 to £300 or £400.
And how much will it be for the NHS, though, for an NHS patient that the dentist gets paid?
So for an NHS patient, the patient charges around about £50 or £60 for that filling. However, we don't get paid that. That goes to the government. They take the patient charges.
Yeah.
So within that, you could get one filling is, say, £90, 3 UDAs. There's lots of complexity there, but 5 fillings would be exactly the same. So it's more complicated. I think it's 3 fillings and moving from there. But it's a banding system, so it's an average fee. So whereas with private, you'd be three fillings would be 3 units of cost. But it's not that. It's the fact that we can prevent disease. So the key thing for me is there should be payment for a course stream for prevention with a patient. I should be able to sit down with Claire and spend an hour to find out what is within her diet and what was changed, how we can stop those. So we don't even need the fillings.
Well, she certainly needs something. It looks to me like she needs a whole mouthful of incredibly expensive, highly labour-intensive implants, or she needs to have them all yanked out. She needs a couple of sets of dentures, but she definitely needs something, and she needs it for her mental health. She needs it for her physical health. She needs it to eat a balanced diet. She needs it to live the life that she should be living, and it's absolutely heartbreaking to see you, Claire, like that. I mean, I just don't know whether any of this is going to make any difference. Claire, do you feel that this incentive is going to inspire someone to come up to your part of Norfolk and set up a practice that will help you?
No, I've got a dentist actually in my village, so it's less than 5 minutes walk away. And they just looked at me and went, "We don't take NHS," and that was it. And then I got ignored. They turned away from me. So there's just no incentive. It's too little, too late. And I always went to the dentist. So I didn't, I've always brushed my teeth twice a day. Now I'm doing it 3 or 4 times a day. I've always looked after my teeth. I've never had any fillings in my adult teeth. And then because of COVID, they got rid of our whole family. They lost 15 of us in our family, and we've now got no dentists. So
can I just ask Ben one more question, Claire? You've been fantastic as a guest, and I really do thank you for doing this, honestly. Very kind of you to do, it really is. Ben, you said, of course, that dental decay and dental disease is preventable, provided people are properly educated and provided there's a prevention protocol in place. You can make sure this doesn't happen. You also said that one of the things that's happened over the last, few decades is a great improvement in the state of the nation's teeth. But are we going to find that we're backsliding quite profoundly when we hear of little ones under the age of 5 being admitted to hospital having their teeth pulled out because there's so much decay? People like Claire who can't get any help. The sands are shifting, aren't they?
I think the sands have shifted. We can see poor Claire, how quickly dental disease goes back. And without the NHS, without a really good NHS supported preventative journey, we will go backwards. And it's wrong, Vanessa. I'm sorry, but it's a fully preventable disease that it's very simple to prevent. And if you take a snapshot, if this is dentistry that I really know about, well, what about the rest of the NHS?
Absolutely.
There's a phenomenal amount.
We haven't got time to address the whole of the rest of the NHS. We're concerned enough about our teeth. Claire, I thank you very much, and I do hope you do find some decent treatment quickly. I really do, you poor thing.
Is there any chance I could go and see Ben?
Oh, let's ask him. He's really on the spot there. Is there any chance that she could come and see you?
I would do, but we're up in Manchester now. If you get the contact details from your Vanessa's team, we'll contact and we'll put it together. We'll see what we can sort out.
Okay, let's see if we can. I'd love to be able to help you, Claire. Thank you very much indeed. Thank you both.